My name's Austin Messick. My background, after I finished my doctorate program, I went into an orthopedic residency program, and then upon completion of that, got my orthopedic clinical specialist certification. So with spinal therapy, I'd say a big thing that differentiates from like somebody who just had a knee injury is that we're trying to determine, is this the spine referring somewhere, or is it a local injury or issue? It's not normal to have pain. A lot of people do experience back or spine pain, back or neck pain. So it's not normal when it becomes frequent or when it starts having a long duration. So if you twisted just wrong and your pain hurt for a couple, or your back hurt for a couple hours, that's probably okay. But if you're starting to get that pain that's starting to happen over and over again, or if you're starting to get that stiffness that just won't go away, that's really when you should start seeking physical therapy. Also, physical therapy can be one of those things that maybe you have a history of back pain, it's been good, but you're starting a new activity, so you want to make sure your back's ready for it. Or maybe you have no history of back pain, you just want to make sure your movement is optimized. Physical therapy can also do kind of more that preventative type of approach to really make sure you're optimizing your function and movement. People don't know that the spine can refer or that it can be caused other issues. So common is like headaches, you get the side of the head, kind of back of your eye that kind of starts at the base of the neck. Oftentimes that's a referral pattern from the cervical spine. Symptoms down the arm, carpal tunnel, burning in the forearm and the fingers, that also can be a sign of a spinal issue, or even sudden onsets of weakness. Suddenly it's like, man, I'm really having a hard time lifting my arm up, or my leg feels weak, my toes dragging a little bit. Those things can all be related to the spine, and that's where spinal rehab can help improve. Same thing with like sciatica. So sciatica is burning down the back of the leg, and it's a strong indicator of an irritated nerve in the low back. Common misconception is that you have to wait for something to last a long time before coming in. Really, it's easier to get you out of pain if you come in earlier. The other misconception that we kind of hinted to is you have to wait for a referral from your doctor. Most insurances, you can come straight to physical therapy. And then kind of another common misconception too is just that people think it's normal, or once you have back pain, you will always have back pain. So a big misconception is, oh, I got a bad back, or I had this back issue when I was young, so I'm always gonna have a bad back. Physical therapy is really going to help optimize your movement and keep your back healthy. Whether or not you're having issues, we have a lot of tools that can help prevent issues in the future, so you can make it through your full career without issues, without pain, and then eventually enjoy retirement. You know, it's not normal to have pain. So if you have something that's an issue, physical therapy can get you in really quick and get you evaluated, taken care of. Sometimes we can even get you in quicker than the doctor. So if you're having pain, if you're having issues, that's not normal. Come in, we can make sure that you have the mobility, you have the strength, and you have the structural support that you need to really succeed in that without injuring yourself. You know, we go to our primary care to make sure everything's good there. We go to our dentist. It makes sense to go to our physical therapist to make sure we're moving. The free consultations, anybody can call. Anybody that has a question about physical therapy, they can call. We can get you on the schedule for those. As far as coming in as a new patient and needing a doctor's referral, basically if you have government insurance, which includes your Medicare, Medicaid, VA, or TRICARE insurance, those will require a referral, but most private insurances such as Blue Cross, Aetna, Humana, those kind of insurances have direct access options. If you're unsure, just call and our front office can help answer if you need a referral or not.
Awesome.